Hello, I'm Dr. Seemab Sheikh. I am a practicing ENT surgeon in Pune for the past almost 29 years. Today I'm here to make a small little video about what's really bothering a lot of us about what is being hyped in the media and spoken about as the black fungus or the mucormycosis. Now, I'm not here to make a very elaborate video. I'm going to be very precise in trying to get out and break a few myths about the situation because we don't want this as a panic situation, and at the same time we don't want this to be underrated and not understood about the gravity of the problem that we are facing in this particular pandemic. So what exactly is mucormycosis all about? So it's a fungus. It's a fungal infection which affects the nose and the sinuses and then destroys every possible structure in and around the nose and the sinuses. So the eyes get affected, the brain gets affected, and it's a very fast, rapidly spreading fungal infection which is very destructive and can be very fatal. But is this the first time that we are seeing mucormycosis? Not really. We have dealt with mucor patients in the past during our careers, and we've dealt with a lot of mucor patients in a similar manner. But why is it different now? It's different now because probably in my 29 years of career, if I would have dealt with let's say an X number of patients of mucor, in the present situation we are dealing with almost 25x number of patients, and that's one single surgeon dealing with that. There must be hundreds of us all across the country dealing with this. That's why mucor has taken this significance. So it's not something new to us. So why is it happening so rampantly? So lots of theories are floating around. I'm not going to get into the theories part of it, but the very fact there are certain things which we surely know. And one of them is the fact that it happens mainly because the patient is immunocompromised and the patient's sugar levels are highly fluctuant. And during this COVID pandemic and this COVID era, this is something that we have been having to deal with a lot, and we're coming across a lot of patients because COVID per se causes a lot of an immunocompromised situation in a patient, and the use of steroids causes a lot of fluctuations of the sugar levels all across. And we know for a fact that steroids are the only mainstay of treatment for this particular disorder. So what's the learning lesson here for most people is to understand the fact that the very strong and stringent control of sugar levels when you are dealing with patients of COVID is the most important thing that is needed to kind of prevent this thing from flaring up further. Now, having said that, we get a lot of people who very loosely talk about the medical fraternity and want to blame the medical fraternity and call this as a kind of iatrogenic issue, meaning that this doctor did like this doctor spoiled the case like this. So please try to understand, the doctors today are fighting a very, very tough battle. On one hand, we know that steroids are the mainstay of treatment and they are life-saving in certain situations as far as COVID is concerned, and at the same time we have to worry about what the post-COVID situation can be. So it eventually boils down to a very judicious use of the steroids, very judicious use of steroids with very proper sugar controls during treatment. Now, because of this, the medical fraternity did come out and has reassessed the way steroids were being used. Newer guidelines keep coming up. So it is important for all of us to realize that, we no longer use steroids for home quarantine patients, not in the first week of the disease, not unless saturations are really falling low. All this becomes extremely important because this is what prevents everything in the long run. So the other thing that has actually come up now is the scare of mucormycosis because of the media hypes and because of so much awareness that is happening. So a lot of people post-COVID are getting extremely scared, and for the smallest of situations, there is a lot of rush to the medical fraternity. There's a lot of pressure on the healthcare systems for the diagnosis of mucormycosis, and obviously, as you must have been reading in the papers and in the media, with regards to the shortage of drugs that are used, which is the amphotericin B. Now, if you analyze and if you see what has happened is that any department, any radiology department which was normally doing say maybe about 25 to 30 scans in a day, in the past month or so before this recording, they've actually been doing something to the tune of 80 to 85 scans a day. And this is sheer out of panic. It's out of sheer panic that not only the normal population but also the medical fraternity to a certain extent that does not want to take any chances on missing out Mucor, because it is definitely something that one should not miss out at all. But again, we need to be very rational about this, and that's how guidelines have come on up, and there are certain red flag situations where one needs to think about doing it, and you don't rush. So every patient of COVID recovery should not be investigating themselves for Mucor, because this will create a huge burden on the healthcare infrastructure and on the healthcare professionals, and it would probably be not justified rationally, scientifically. So we come up with a few kind of red flags where, if there have been patients who have received a lot of steroids, patients whose sugar levels may have fluctuated a lot, people whose HbA1c that we do has probably been much on the higher side, so we know that sugar levels have been high. These kind of patients post recovery, if they come in with any kind of symptoms to you with say orbital pain, headaches, nasal stuffiness, nasal blockage, nasal bleeding, jaw pain, tooth pain, even simple things like this area of the cheek, if you have different sensation or loss of sensation for that matter, these are all red flags that need to be investigated, and these are the ones that you should take up on a priority basis, not just every person getting over anxious about the particular post-COVID development of mucormycosis. This is a more rational way of looking at things. This is a more rational way of approaching the disease, especially at a time when we have tremendous pressure on our health system. Now, the treatment protocols for mucormycosis, like I said, since quite a few years and years earlier, it's not a new disease to us. Just the numbers have come in such proportions that it has become very difficult to handle, and that's where issues with amphotericin availability, its usage, its dosages, the follow-ups, everything has become an issue. So one needs to take it in a proper understanding that yes, we are aware of what this can be causing post-COVID, but at the same time, it has to be taken with an understanding that not everybody post-COVID is going to land up with mucormycosis. The numbers today in our country are huge, but if you look at it statistically with relation to the number of recoveries and post-COVID recoveries and people doing well, then obviously it's in control, and it hopefully will get better under control over the next few days and next few weeks. Some of the other theories which I think for a common person to understand with regards to the spread of Mucor is the fact about the use of masks and the talk about the oxygen humidifiers being a route for transmission. Now, one can go on speculating as much as one wants, but you have to understand certain rational things. So if it was to be transmitting through the oxygen air pipes or through the humidifiers, Mucor would reach directly to the lungs, and the incidence of our lung Mucor is still much lower as it is as compared to the sinus areas, and that's where the role of an ENT possibly comes in. So it's for speculation. There is no such thing to really confirm that. So is the same situation with regards to the masks. People are talking about damp masks being used and reused again. But if you go back and understand what has been happening, these kind of skepticism should not come in. So right at the beginning of the pandemic last year, not only WHO, all associations in our country had come up with very clear guidelines on what kind of masks to use and how to use them. So we are advocating very strongly not to use cloth masks. We are advocating the use of N95 masks. Each N95 mask is not to be used beyond 5 times with intervals of 5 days. So we've spoken last year about the use of mask. One mask on day 1, day 2, day 3, day 4, day 5, and day 6 the day one mask gets used again, and similarly the 2, 3, 4, 5. And you discard each mask after the use maximum of 5 times. So these are points that really I'm not elaborating on because I'm presuming that people already understand this, but this is what is important, that do not get into skepticism. All in all, I want to keep this very short, and I want to bring it out to all those who are probably watching me that yes, Mucor is a very dangerous disorder. There is no doubt about that. It has to be at a very high index of suspicion and it has to be tackled as early as possible. But having said that, every symptom that you get post-COVID is not to be related to Mucor itself. And if we analyze the reasons why this has been happening and we go ahead with very proper glycemic control and with the judicious use of steroids under proper supervision, then I don't see that we should have too much of a problem. I hope this helps. Thank you very much.